Here it comes from the Monkey Studios, Sussex Middle School. It's the health class. Eight B, come on down. Mr. Monkey subscribers, come on down. And you are the first and only two groups on this special edition of the health class. And here's your host, Miss Melena Palmer.
Finishing up on the contraceptive, I think that we have about 10-15 slides left maybe, and then when we finish up on those, we'll go to the sexually transmitted infections.
Oh, that's not too good.
Great.
That was scary.
Oh, yeah.
Oh no!
Hey, Miss Palmer, I'm gonna get the lights.
Hey guys, grade 8. This was the one that we just said we were going to go back and look at because we just talked about it really, really quickly. Because some of you were like, really? But obviously, we said the reason why they have the dice over there is this one. Michael, I need you to be quiet, and you'll need to go back to your seat.
Withdraw.
And so it is just simply where you're really not using any method, but male is just making sure that they withdraw or remove their penis from the vagina before ejaculation. The dice would be there because that's pretty chancy. Probably not gonna be very effective. So, the advantages, some people might say it's just better than nothing at all, but no sex at all is the best. The disadvantage is it doesn't work very well, and males usually have a little bit of pre-ejaculation. And if you know that in that 1 or 2 teaspoons of semen that they have, that there are like 300 million sperm, do you think there's going to be a little bit of sperm in that pre-ejaculation? No. For sure there is. And again, you're not protecting from sexually transmitted infections either. So for that one, they say that's like chance, or they're saying chance is if you use no method at all, it's very low, and if a female uses no kind of contraceptives, the chances of them becoming pregnant are 85%. It's pretty high. And if you're not using contraceptives, just like I say, if you are being sexually active, you are planning a pregnancy. And that's what you need to think of.
I'll be.
Okay? So, girls and guys are always quite interested in this. And this does not, and I'll tell you something else too, that maybe you might not realize, but probably girls are probably most fertile in their late teen years, early 20 years, right? In those early 20s. So, people who don't use any contraceptives, if they're being sexually active, 25% of those people become pregnant in that first month. 50% of those people may become pregnant if people are sexually active for about 6 months. People who have been sexually active for a year, 85% of them will be pregnant. So those are big numbers.
I suppose.
Yep.
I like those odds.
Oops. And then the other thing, how much do you think it may cost to raise a child? And this was way back, well, you saw the answer.
That's a lot of money, man.
This was in 2011, so that's, like 6 years ago. And the answer is D. That means from the time a child is born until they move out of their home. Whereas, and this price may have gone up too, but birth control would only cost about $20 now. Right?
This makes me realize how good that saying was.
Okay, let's have a look at this. Birth control, how much do you know? Let's just see. Name 2 reasons why a female taking the birth control pill becomes pregnant. One, what?
It's no good.
No, your doctor would make sure that they wouldn't expire because you have to use them within that month, right? So no, they wouldn't expire.
She didn't take them the exact same day and the exact same time.
Right, has to be taken at the exact same time. Can you think of anything else?
No, didn't take them all. She skipped a few days.
Yeah, and that's what we're trying to think of. What are the improper uses? Not taking them on time.
She gets the wrong thing. Like so you said, your doctor prescribes you with a certain form of birth control.
Yeah.
So maybe they take the wrong one. I don't know.
Yeah, but your doctor would know which kind to give you. The only thing that your doctor has to make sure of is they need to know if you're a smoker. Because that can. Okay, so let's look at a few. When we talk through some of these, forgets to take the pill, doesn't take it at the same time. Why do you think being on antibiotics could affect it?
Well, like penicillin, killing it.
Your antibiotics can do what, Laura?
Boost the immune.
What did you say? You were right. Your antibiotics can.
That was me. It's gonna kill your.
Oh.
It's gonna kill the pill.
Yeah, it doesn't kill out the pill, but it just makes the pill ineffective. And another thing that a lot of people don't realize that when a girl starts taking goes on the pill, it takes 1 month before that pill works effectively.
So you have to take it 1 month beforehand, eh?
Right, right.
It's like your plan.
And that's like anything. If I get sick and I get prescribed the antibiotic, the first time I take that antibiotic, it doesn't clear me right up. It takes time. Well, those hormones have to get into your body before they can work, before they can work properly. And 2, imagine if you take your pill and then you get a flu and you start puking. What's going to happen to the pill? Right, the pill's going to come out.
That happened on The Walking Dead.
And so, what it's saying here is, if any of these happen, that might be time for plan B, maybe taking the morning after pill. True or false? Pills make you have mood swings.
Correct.
Well, that could
No.
that could be anything.
False. False. False.
Some people say false, Robert put it away. Some people say true, let's see. False. Really, your mood swings are caused by what?
The people you're
No, usually puberty.
Right?
Right? And boys and girls both go through that, but it might say, in most cases, irritability or depressive moods have other causes other than use of the birth control pill. True or false? A girl can become pregnant the first time she is sexually active.
True.
Yeah. Hey, I hear some people say no. True, of course. Girls can become pregnant at any time
She has
if birth control.
Do those things work?
What?
Those testings did?
Yeah.
How do you use it?
It's just urine. You just, when you sit on the toilet to pee, you would just put that in the flow of your urine. And what's gross about that? He doesn't touch your hand. You just get a long stick. You would just go, if a boy were to pee, you could easily, which you would never take a pregnancy test, but That's all it is, Isaac, because the proteins in a girl's urine changes if she's pregnant. And so, that's how they can tell. It's just urine. If a girl were to go to the doctor and maybe the doctor say, is there a chance you could be pregnant? Because maybe you say you have a problem of some sort. And they oftentimes will ask you that. And if a girl says, well, I don't know, the doctor's going to say, okay, are you sexually active? If your answer is yes to that, 9 chances out of 10 your doctor's going to get you to go pee in one of those little cups for a urine sample to rule that out, right? So it's just urine. True or false? Not using any type of birth control is an effective method of birth control. No. Okay, well, let's see. Of course. Of course. Because remember, they said 85% of women within a year of being sexually active get pregnant if they're not using any kind of birth control. That's why they're just giving you the other end of the statistic, Gavin. They're just giving you the 15%, the opposite of it. Okay? What is the most effective way to prevent a pregnancy? Pardon me, Mason?
Don't have sex, I guess.
Abstinence.
I mean, there's.
Abstinence is worry
Just
free.
care what I was pregnant with you. She did it for my life.
Just get a closet
Okay? Does anybody have any questions?
Yeah. No.
You do or you don't, Mason?
No.
Girls, you must have questions. Lots of chatter over there. No? Okay. Now you're just full. So now we're going to go on into the STIs.
This scares me.
Why?
This just makes me not want to grow up at all. Makes me want to stay.
Destroyed.
Nice shot, Gavin.
Because sexually transmitted diseases and sexually transmitted infections are two different things.
You guys, one thing to think about, remember how we said about the only 100% effective way that a girl is not going to get pregnant is if they abstain from sexual activity. Abstaining from sexual activity is also going to help with sexually transmitted infections, but the main thing that people need to realize is it is not just through sexual intercourse that people can get sexually transmitted infections. And we'll talk about that. So you have to be very careful, and if you are in a monogamous relationship, does anybody know what that means? What does it mean, Sydney?
Just like, there's only 2 people in the relationship.
Right. And that's all there ever has been, meaning you have one partner, and that is it. That's only 2 people. I'm in a monogamous relationship. I am married to my husband, and I have been for 18 years, and that is it. That's a monogamous relationship.
That's a long time.
That's not, you've missed the point. It's having one partner for your lifetime. That's what we mean.
That's what divorces comes in.
Then that's okay.
Secretly.
What?
Okay, your first partner before second.
Whoa. I think
Oh,
what
yeah.
you're
Oh,
saying is obviously if you're having sexual intercourse with multiple partners at one time, that's very dangerous. But I'm going to show you something here, and it will show the incidence. And there are a lot of sexually transmitted infections that are very high in the province of New Brunswick. Just saying. Specifically in New Brunswick, So there's an interesting visual that I'm going to show you about, and that will answer your question, Gavin. It will show you that. Barrett?
Wait, I thought it was like illegal to have another partner relationship. That's to get married.
That's with marriage, but I am sure there are people in here who know people who are in a monogamous relationship and that's their only partner, but they may not have the papers to say that they're married.
Oh, yeah.
No, I'm just saying, like, can you have like 3 people get married?
No, that's called polygamy, and that is illegal.
Oh,
Do some people do it, and are they in illegal marriages? Yes, and if you were ever found out, then that is why people in those polygamous communities, if they get caught, some of those people can end up going to jail and their children can be taken from them because it is illegal to have multiple wives.
Why?
What?
Saudi Arabia. This isn't Saudi
We're not in Saudi
I live in
Arabia.
Saudi Arabia.
We're talking here.
We're not in North America.
Yeah. In North America, it is.
I'm just saying,
Yeah. Well, I don't want you to confuse people. Like we're talking Canada, right? Just like if you were in African communities, it's acceptable for girls to start giving birth to children at 12 and 13. Not acceptable in North America. It's just different. So let's just stick to here, just because that's where we're at. And I wouldn't really know all of the for certain. Yep, sure. Okay, did anybody else have any other questions about that just before we get started? I think you can let it go, I was just saying. I'm just talking about North America. Yes. If it's an extreme emergency. Okay, so you guys, your sexually transmitted infections.
What about STDs?
Okay, we'll get to that.
It's not the same thing.
Well, okay, sexually transmitted infections. If you have an infection in any part of your body, no, I need for you to listen. If you have an infection in any part of your body, how do you care for it?
Come off.
You go to the
No.
hospital.
I take pills.
Go to a doctor and
Get some pills.
Get some
yes, you guys, listen. Michael asked a good question. Infections you can get rid of. If I have an ear infection, I go to my doctor and he'll say, oh, Melinda, you have an ear infection. You need antibiotics. If I have a lung infection, I need antibiotics. If I have a disease, can I get rid of it?
Very hard work.
No. It can be managed, but you can never get rid of a disease.
If it was like an outer body infection, couldn't you just let it bleed out?
What?
Like I know if like you get
Guys, grade 8, this isn't going to work today if you guys can't settle down. Because, like, Michael's had good questions, and Charles has a question here, and you guys are just all having your own individual conversations. I can't even hear Charles. Go ahead, Charles.
if you had like an infection on like your finger or something, couldn't you take a needle and let it bleed out?
Well, it's not an infection if you don't need, like, you guys don't get it. Oftentimes people say, oh, I have an infection, but if you have an infection, you normally need medication, either ointments, antibiotics, or whatever, to clear that up. Can you have something irritated and not need medication for it? For sure, for sure. But an infection means that there is something foreign happening in your body and you need to take medication to rid of it. When you have a flu, that's a flu bug. That's not an infection. You gotta let it run its course. When you have a cold, you gotta let it run its course unless it goes to some sort of an infection. Darren?
Wait, so you can't get rid of a disease?
No, if I have diabetes, I have it. It's a disease. I can take medication to maintain it. If I have MS, muscular dystrophy, any diseases, the majority of them, you are born with them. And no, some of them, you may be able to take medications to maintain them, but a disease is a disease. Yes?
Like, but what about is leprosy an infection or a disease?
Yes, not a disease.
Oh, okay.
So a lot of things you just need to know the differences between a disease and infection. So we're going to discuss STIs, what they are, signs and symptoms, how they spread, and the risks, and the prevention. Prevention means how to stop them. Okay, Laura, I think you need to go back. Because you guys have just been talking the whole time. So, and then there's different kinds of testing and treatment. And this is going to go through all of these. So, wait a minute. Maybe you're not even sexually active at this time in your life. I pray to God that none of you are. Why do you need to know about STIs? Well, you may become sexually active in the future, and it's just like when I teach you guys about all those different drugs, I don't teach you that with the assumption that you're going to use them. I'm hoping you never are. I teach you that with the assumption that you're going to make informed decisions now that you have that information. Same thing with drugs and alcohol, right? That's why we educate kids, so they can make decisions and not say, well, nobody told me about that. I didn't know there was anything wrong. I didn't know that could happen. Now you'll know the things that can happen. And another real big thing is a friend may need your support. Okay? The classic message, we've talked about this. Obviously, the best form to make sure for contraceptives or for STIs is to abstain, meaning not have sex or to postpone that. If you are going to be in a sexual relationship, it's important that you communicate and think about protection.
No way.
Give each other thumbs.
Have fun with 17 kids.
Oh,
19.
So, this is kind of, I think it was Gavin who said it, maybe Barrett. This is the thing that I wanted to show you that kind of shows, you know, when you said, oh, well, what if in your lifetime you end up having more than one partner? Isaac, okay? So this, I know somebody right there in that row, along there. This will help explain that. So, there's one girl, she's had 2 partners. But what she doesn't know is maybe one of those men has had 2 female partners. Oh, and maybe one of those other men have had 2 female partners. Is there a possibility? You do recognize what the sex is in the middle.
Uh-oh.
Oh, they're bi. He is a man.
Could be.
So, what you have to realize that. And that's the reality. And what you need to think of is any partner that you've had, you don't know who their past partners were.
There's only a few people.
Not that many.
No, remember they know.
Yeah. There's only a few hundred people.
Yeah, so these people be cougars.
Yeah. How many dots are there?
Cougars in here.
How many clicks are there?
Just a cat. You're not bad, are you?
Is that a stand?
What?
It looks like a popcorn stand.
That's how it started. Netflix kill.
I'll have to turn that part down.
5 hours later.
So what you need to look at is you need trying to think. There could be the possibility that even though you've only had 2 partners, it's like you could have possibly had 88. Because what you need to think of is if one person that you've had sexual interaction with, if they have passed sexually transmitted infection to you, there's a possibility that all those 88 people could have that too.
That kind of looks like a family tree.
When I was a kid,
That's the second one again.
in the 80s, the AIDS epidemic was a huge thing in North America, and so they had lots of commercials on TV. And so some of the commercials they'd have, it was all these movie stars, and they'd snap their finger, and then like another one would. And it was just a quiet commercial. And then at the end of the commercial, they'd say, in the time of the commercial, they'd say, that's how many people have died of AIDS in North America while you watch that commercial.
Easy.
So then they had another one. Then they had another one that they tried to compare a sexually transmitted disease or a sexually transmitted infection as a gift. And it would show a person give the gift to a partner, and then that partner, they're just it's not a gift, it's just trying to make an analogy. But if you end up having sexual intercourse, that might be the gift you get if one partner has an STI. And then every partner that you will have after that, you're going to give that to them. It's basically just saying you're going to give it to that person. It's obviously it's not a gift, it's the worst thing imaginable that you could receive. But a lot of people don't realize that you have to think of when you're having, if you're choosing to have sexual intercourse with somebody, you have to think you're basically also having all of the past history that all of the partners they've had. That's the reality. So that is how sexually transmitted infections are passed.
It's the gift that keeps on giving.
Right.
Whoa!
So,
It ain't much of a gift.
what is an STI? STI stands for sexually transmitted infection. STIs can be transmitted during any type of sexual contact with an infected partner. Some STIs are infections that are transmitted by close skin-to-skin contact. And we'll get into those ones. Many infections can be present in and be spread by partners who do not have the symptoms. Some people may feel like they don't have any symptoms, but that maybe they've had a number of partners. And, maybe for whatever reason they go to their doctor and the end of this says what kind of testing you need to have done. And they may not even know if they have a sexually transmitted infection. Yes, Gavin?
How was it started?
Well, like anything, like lice or anything. It starts somewhere and it just keeps passing from person to person. Like scabies, it started somewhere. It's just an infection, just like who has the first, when you guys get a lot of things, a lot of infections are not transmitted. Like if I get an ear infection, you can't catch the ear infection from me, can you? No, doesn't matter if we touch our ears or whatever, it's not transmitted person to person, right? These things that we're looking at, they are transmitted. That's why they're transmitted sexually, and they are infections that can be cured. So this is just one of the things that comes from sexual activity. So when we look at the organisms, there's bacterial infections, which include chlamydia, gonorrhea, and syphilis, or there are viruses, which one of them would be HPV, the human papilloma, herpes, HSV1 and 2, HIV, and also hepatitis B and C. Well, those ones too, yeah. And then the other, there can be yeast infections, pubic lice, and that would be what you would hear people call, say, crabs. It's lice that is in your pubic hair. Because it's not the same lice that people get in their hair.
Cool. It's fine.
It can only be transmitted sexually. Whereas, if I have lice and I go stand beside Sydney, she can catch my head lice right from my head. If you have, that is not the lice that is pubic lice. The pubic lice is what we would call crabs. It is a different bug, and the only way that can be transmitted is sexually. So either two girls, two boys, or a boy and a girl would need to be naked together in those areas, which there would not have to be any sexual intercourse, but if those areas are close to one another, that can be transmitted. Just like if girls are in, just a second, I just want to explain this. If girls are in a lesbian relationship, they're never having sexual intercourse because they don't have the body parts for that, but can they still
Yes, they do.
sexually, can they
No, they
still,
can buy that.
Oh,
can they
yes.
still transmit infections to one another?
Yes, they can.
For sure. And the same with males. It's the exact same thing. Go ahead. Can you get rid of it? Yeah, all of these things you can because they're infections.
Yeah.
Okay? No. Do you see AIDS up there?
Yep.
AIDS
That's
is
what HIV was.
no. AIDS is a disease. Okay. Are we ready to keep going? So, signs and symptoms. This is a scary thing. The number one sign and symptom of an STI is
Sorry, guys.
there are none. For females, remember how we talked in grade 6? Those of you that I would have taught health to, we talk about females starting to have a little bit of vaginal discharge. Well, if a female has a STI, they may feel that vaginal discharge, either there is more of it than normal, or maybe there is a not so pleasant smell with that. For any male or female, there could be a burning feeling when you pee, when you urinate. That can happen to both males and females. There can be pain and bleeding. There could be pain and bleeding with intercourse. That would be more so, I would think, with a female, but a male, I guess, could have cuts also on their penis also, right?
We could what? Ouchie.
Because it could be, Nella, and remember that you're in grade 8.
No, I
It
thought we
could
were
be
in grade
because
2.
that's irritated, right? And if an area, listen you guys, this works the same as any other area of your body. If an area of your body is irritated to the point that you're having to scratch at it, sometimes, does it become an open sore?
No.
Yes. Hello, you're going to tell, you've never had a fly bite that you've scratched till it's had a scab. You all have. That's an open wound. You've never scratched a fly bite.
Yeah.
You can't stop. Everybody scratched something to a point where they thought, oh, look at, I got like a little bit of a blood there or something.
There is only.
Okay, we're not just talking about a fly bite though. I'm talking about everything that might make a person itch. That's the same thing with your genitals.
Like those Christmas sweaters?
Yes.
Yes. If a female is, you know, like it said there, that burning feeling, you might get sores.
I know.
So you guys can read the rest of those. And then it said these symptoms could be on their own. They could be, you might have a few of them. Right?
It's amazing. It popped out of the side.
That's not
That looks like a dog.
I'm just.
Oh, you're crazy.
So,
Yeah.
When they say this was exactly, Noah, this is exactly what we were just talking about. Like they say, signs and symptoms of STI commonly occur for males. They occur on the penis or in the urethra in males. For females, it can be in the vagina or on the cervix. A woman can't see her cervix either, or her vagina, because those are up inside of her. Now, she could have vaginal discharge. Also, it could be around the openings of the vagina or the anus, the bum. Sexually transmitted infections could also be in the throat, or the mouth.
Wow.
STIs. So, if you're in a relationship with somebody and all you're doing is touching, if you're touching with your clothes on, I'm going to say you really have no risk of an STI, but they said just a few. If you're having oral sex, some people always say to me, there are some people who don't know what that it is. Oral means using your mouth. Sex obviously would be using your mouth sexually on either with a male's genitalia, a penis, or a female's vagina. So obviously there are many STIs you can get that way. And if you're having vaginal sex, you have a risk of getting all of the STIs. Okay?
I'm just saying, they're glad I'm not. I don't have
Is
the
everybody
slides for
good to
this.
go? Oh, or sorry, I forgot about that anal sex also. Anal sex, that's when
What?
Kids, do not look this up. This will ruin my childhood.
Yes, it will.
Yeah.
You're gonna like the idea I had for the beginning before this.
Okay.
You're gonna like
So
the
now, you
have
guys,
plans.
so we talk just here in our own province. We talk here in our own province and in Canada. What was the number one reportable STI in 2012? In Canada, there was 103,716. In New Brunswick, there was 1,923. And what was that? Chlamydia. Yes.
Let's call them check.
Now, these are the number of positive cases. If there are that many positive cases, there are probably double that number of cases of people that don't know they have it. These are only the people who came in for testing. They do say chlamydia is a silent epidemic. The numbers under represent the actual number in the community. So when we look at this, these are the different, you can see chlamydia is that yellow bar, it's obviously the highest. Gonorrhea is that red, not too high. Syphilis is that purple, not too high. HIV is that orange, not many at all. And then AIDS is actually the disease. Once you have AIDS, when you have HIV, you can possibly get rid of it, but if it goes to full-blown AIDS, no, you can't get rid of it. Can you manage it?
More
You
easy.
can't get rid of it.
More easy.
And so those show the numbers.
I
Your
know.
number
I know.
on your axis over here, that's just saying that's the number of people. So it's just up to about 2,000 people.
Such bad idea. You want your video age restricted.
Yeah, it's gonna be restricted.
So, chlamydia, the most common bacterial sexually transmitted infections. 80% of infected females and 50% of males have no symptoms. It's spread through unprotected sexual consent. Cured, though, with antibiotics. Okay? So it can be cured. So you can get rid of it completely, 100%, altogether.
Hey, at least there's a cure.
Yeah, but you would have to go and get tested to a doctor to get
Yeah.
it.
Yeah.
And it's just antibiotics.
I am really glad I don't have these slides.
Deer.
Oh my god, it does.
No, that was
What?
So what happens is, you guys, for females,
I don't want to know.
the problem is if a female ends up with a sexually transmitted infection like chlamydia, you can see the damage that can do to her fallopian tubes, or that they can be inflamed. Is that going to make it possible for a woman to become pregnant? And it may make it more difficult. So that's why people need to be very careful, because most women want to have children, you know, when they're ready for that in their life. So you can just see how it kind of breaks down, and you can see it's trying to show how when the egg is released from the fallopian tube, from the ovary, and is traveling the fallopian tubes, there's a buildup there, so it's hard for the egg to move. And then too, it can see like the cervix can break down a bit too. So gonorrhea, it's also a bacterial STI, and it often comes with discharge. How is it spread? It's spread through unprotected sexual contact. It can be cured with antibiotics. But what they're just saying with that, it's becoming more resistant to treatments. So again, the complications for that, you can
It's not on.
see, again,
Especially so it
Don't
doesn't
be
look like
rude.
this.
not funny at all. You can see it could be inflamed fallopian tubes, or again, that fallopian tube could be blocked. So just the same as it was with the syphilis. With the gonorrhea, sorry. So syphilis, there are primary painless, they call it a chancery, or secondary. It's a bacterial infection, sometimes called the great imitator, because symptoms kind of look like those of others. It comes in 3 stages, and it only becomes infectious in the first year after, once you've gotten it. And it's treated with penicillin and other antibiotics. HPV, a lot of you girls would have had needles for HPV in grade 7. In Nova Scotia, they actually pay for the boys to have HPV too. Our province is too cheap, I guess. But anyway. So what is it? It's a viral infection. There are 40 types found in the genital area. They can have a low risk and high risk types. High risk can progress to cancer. So when you got that HPV shot, if your mom or dad explained to you, it's a shot that you're going to get because HPV can cause cancer if you end up with it. Well, those of you who got that shot, you know that this can't happen now.
Why can't we the boys get it?
It's just that our government didn't pay for it. The boys can go get it. It will cost you $350.
Holy crap!
I'll take my chances, thanks.
Vaccination is given to the girls and boys to prevent certain types of HPV. It's transmitted through direct sexual contact, but oral sex and skin to skin is also a risk. It may involve removal of the HPV. Most HPV infections clear on their own within 1 to 2 years. So when we talk about herpes,
Hey, they thought.
This is going to be a good hint.
herpes is a viral infection. It has 2 types.
Oh.
It has two types, type 1 and type 2. It is treatable, but there is no cure. HSV1, it could also just be known as a cold sore, but it can be passed to the genitals during oral sex. There can be skin-to-skin contact. If somebody has a cold sore and they kiss somebody, that other person could get the cold sore also, right? Women seem to be more susceptible than men. 7 out of 10 times can be passed to partners with no signs or symptoms. Complications and treatments. What are the complications? Well, if you get it in your genital area, there can be painful blisters. Psychological impact is huge. It can be passed from a mother to a baby during birth. So if a mother has that, it could be passed on.
That
It
image,
is
though.
just treated with antiviral medication, but there really is no cure. Human immunodeficiency virus. This is just HIV. It's a virus that just weakens your immune system that can progress to AIDS. So do you see, really, AIDS is the only sexually transmitted disease, but it starts with this, Michael. Okay? So that's why if everybody knows everything that they need to know about the sexually transmitted infections, they really don't need to know about that disease, right? It can be treated with antiviral medications, and there is no cure for that one yet. And what are the complications? Well, the complications of HIV is it can become AIDS. Hepatitis B and C. It's just a viral infection that affects your liver. So it doesn't affect, it's not talking about anything in your reproductive system, but your liver you need. How is it transmitted? It can be transmitted through the exchange of infected blood and bloody fluids. Yes. Right. Oh, body fluids. Blood or body fluids. Sorry. Thank you.
Does that mean that
Yeah. Or through hepatitis C.
5 minutes.
So usually how this is passed on is people who are drug users and use needles. I'm hoping you guys will never have to worry about that.
What's that?
That none of you will be drug users using needles.
Yeah.
I know, and that would be how the majority of this would be transmitted, right? Just using dirty needles. Needles. Has nothing to do with noodles. Or, so for some people, if they went and got a tattoo in a place that properly didn't clean their stuff, could be transmitted there. That's why people say, don't go get a tattoo at a shoddy place. Or also if you were getting body piercings, and the place, body piercings too, and the place wasn't really clean.
Oh, that sucks.
All that stuff needs to be cleaned.
I hope
How
I
is
can
it
find an image
treated?
online.
This one, some of them will clear on their own. Some will develop chronic infections. Those with chronic hepatitis will probably have to take medication. When should I get tested? If you have sex without a condom, or a condom breaks and your partner has had other partners, if you find out your current or past partner has an STI, if you have sex under the influence of alcohol or drugs, if you or your partner have symptoms, if you have been raped or assaulted, if you or your partner have piercings or tattoos, you may want to be tested.
Well, I'm heading straight to the doctor's office.
Are you worried? You have a... I
Okay?
do know anything.
So, Charles, listen. Be safe. Be tested. It's showing you this can be tested through up here, urine, blood, or through a swab through your mouth. Prevention.
What? That's nasty.
The safest, grade 8, the safest way to present is choose abstinence. Postpone till you are ready and the relationship is ready. Stick to low-risk activities like hugging, kissing, holding hands. Safer, talk about it, get tested, always be prepared and have protection. Safe, Always use protection and have one faithful partner. Unsafe is chance, no communication, no protection.
No one night stands.
Mason, you gotta get your log marker still.
Be safe. Condoms greatly reduce the risk of infection, but yet they don't reduce the risk of pregnancy really, really high.
No, not
So, you know, condoms use is a sign of responsible decision making, respect for yourself and your partner. Where to go for help? Here over at the Sussex Health Center, we have a sexual health center. You go to your family doctor. You go talk to Mrs. Byers. St. Joseph's Urgent Care Center. The only reason they put that on here is it was nurses in St. John, and that's a hospital in St. John. Or there is an STI information line, which would probably have been on those link cards.
Okay, I'm ready.
You can probably look it up
As soon as the
too.
bell starts.
Anybody have questions?
Alright guys, for YouTube, 1 more minute. We got 1 minute left.
We got 1 minute, so let's get this done.
Robert, you want to put the light on for me, please?
Alright, that's a wrap.
And that's a wrap.